Lung cancer in non-smokers, often referred to as never smokers, is a significant and distinct subset of lung cancer cases. While tobacco smoking remains the primary cause of lung cancer, a notable proportion of individuals who develop lung cancer have never smoked or have very limited exposure to tobacco smoke.
Smoking is the most common cause, but nowadays what we see that non-smoking is also associated with many cases of lung cancer. The common causes in non-smokers are the second-hand smoke, which we see in the form of passive smoking in most of the places, the smoke which is emitted from the transport and the vehicles which we see in the roadside, and other agents like radon and asbestos, silicon. These are also some other factors which may be linked with lung cancer, which is not associated with smoking.
While lung cancer symptoms can manifest in both smokers and non-smokers, there are some differences in the patterns and prevalence of symptoms between the two groups.
There is no difference in the symptom wise because mostly the symptoms which the lung cancer patients presents are either a cough which is for more than 2 to 3 weeks. These are the common factors or the symptoms which they present, and it's generally not different from the smokers.
Even though non-smokers have a lower risk of developing lung cancer compared to smokers, there are still preventive measures they can take to reduce the risk further.
Preventive methods, which is that we should stop second-hand smoke in whatever way it is possible. If someone is smoking in front of me, we need to stop that. That means the public space smoking and all these aspects needs to be stopped. The emissions from the vehicles also needs to be reduced to as much as possible, and the air pollution or the air quality index which we see is not so good in most of the days now, which we see mostly after the Diwali, what we see that the air quality index has deteriorated. So we need to, the government and all the health sectors need to take measures to decrease the air pollution index and to improve that air quality. That's most important thing.
The treatment approach for lung cancer, whether in smokers or non-smokers, is generally based on several factors, including the type and stage of the cancer, the overall health of the patient, and individualized considerations.
We see that for early stage lung cancer, whether it's smoker or non-smoker, we go plan for surgery, and advanced stage lung cancer, what we see that we have different molecular tests, and which is we see different mutations which are more common in non-smokers, like the EGFR mutation is more common in Asian female non-smokers. So that is what we see. So the treatment is mostly dependent on the type of driver mutation which is present, and it's mostly in the form of different tablets or agents. So it's not very different from the treatment in smokers, but yes, it's mostly a molecular driven